therapists. I mean, at the Maine CDC, there are folks who focus on occupational health issues, whether it's injuries within the workplace or occupational health hazards
I got
or...
my certification through Auburn.
Oh, okay.
Auburn, yes.
Okay, good for you. Yeah, I mean, I see a fit there. And again, public health is so broad, and maybe this is because I'm so excited about the field. It seems like everything is relevant, but I mean, clearly there's a body of work in public health that focuses on occupational health.
Yeah. So my office, where I'm based, we actually have public health units in the state. So this also sort of substitutes for the fact that we don't have a large number of local health departments. And in my office, I sit with public health nurses who have, I think they're one of the state's most valuable assets, to be completely honest. They do home visits to provide maternal and child health support for new moms, to help with breastfeeding, to help making sure the child is getting adequate nutrition, to make sure new families have the resources that they need at home. They're also able to provide, they do directly observed therapy for our TB cases, all sorts of different things.
I think one of the things that you get by combining the degrees is that an MPH has you looking at population health. Mm-hmm. That's one of the ways that it sort of distinguishes you. Whereas nursing, you're dealing with it generally, like a patient to provider sort of interaction, or thinking about patient to family relationship or whatever. And that you still get that in public health, because as Brenda said, it's huge. Like you probably could name any topic and we could tie it back to public health in some way. Yeah. But I think by combining the 2 degrees, what you're getting is the ability to apply some of the nursing concepts to a broader population. And there's a lot of overlap. I don't know the exact nursing curriculum, but I know that community health is a big thing in nursing. And so, you may have seen, and probably will be seeing now, our flu shots, the nurses have been really key in helping to get people immunized. And so that nursing skill, or that clinical piece, is allowing folks to be able to give the immunizations, but we are, from where we sit, is that we're pushing this statewide strategy. So the Maine CDC, from a statewide perspective, is we're trying to figure out where the vaccine's going to go, we're ordering it, we're figuring out who the high-risk people are, and then, nurses either work in our office and are doing that, or they're on, the ground level, actually doing the shots. So, I don't know if that's helpful at all.
That's helpful.
And then, in terms of teaching too, because one of our biggest challenges, I think, is when we're doing these investigations, we're coming from the public health perspective, which is we want you to tell your patient to learn, to counsel your patient about how to learn how to not spread this particular disease to other people, because then it becomes more common in the community and more people get this, and then it becomes a bigger issue. So the more a clinician can be thinking, oh, this is not about my interaction just with Jane Smith here, it's about my interaction with Jane Smith and how she relates to the broader community.
One nice thing too that we're seeing in terms of trends is that in specific practices now are taking a population perspective by actually doing disease registries. So, as Mary Kate was saying, yes, it is the one-on-one, but they're also now looking at, with all of our patient population, what's going on? What's the compliance rate for this? How many are smoking? Where can we intervene? So there is, I would say, a trend I've seen over the last 10 years or so for even medical practices to take a population-based perspective. And I'll tell you, even in our coursework at Muskie, I love having physicians and nurses and healthcare practitioners in the course because they bring such a great perspective. And it's quite common, I think, for people to come into public health with a clinical background. Is using some of the theory we have in public health to try to figure out how do you intervene with some of these complicated public health issues. Sometimes we have public health issues with very clear messages, like sudden infant death syndrome. The message is pretty clear. Put your baby on his or her back to sleep. There are other things, though, that we don't know exactly what the message should be. If we're trying to solve, childhood obesity, that's a really complicated issue. And what Mary Kate's talking about is using some of the existing theory that we've got in our field, something like the socio-ecological model that really focuses on, individual characteristics. It looks at your social networks and family and what influence does that have on this issue we're trying to impact. It looks at broad conditions, it looks at your living environment and your workplace. And from a population-based perspective, we try to intervene at all of those levels if it makes sense to do so. So it's, yes, you need the epidemiological data to figure out, what is this issue, and then when you figured it out, you also want to figure out how do we intervene? How do we intervene? Does it make sense for us to do these broad policies at the state level or at the national level, or do we need to focus on the social connectedness of our community? Is that what you were getting at?
Yeah, yes, thank you, Brenda. What I was trying to think about is how there are different ways that you can get involved in public health depending on what your interest is. So even just getting a basic, a concentration or certificate or a minor or whatever, this allows you to be thinking about these different ways of approaching a particular issue. So that might even be, you could cater to your particular personality or interest. Like, for example, if you're someone who likes one-on-one work, like you want to directly counsel people about nutrition, that is one way of addressing that problem. Another, as Brenda was saying, is about your social relationships. So you're looking at what kind of social support do people have towards weight loss or healthy eating? And another is, what access do they have? Like, do people have to travel long distances to get fresh fruits and vegetables? And then you're looking at, what policies, like you may have heard, I can't think, there was the Maine with the beverage, they took the soda machines out of the schools, I think. Mm-hmm. So you're changing the environment of what people have access to in terms of healthy eating, or you're getting taxed for buying potato chips or something. Still take your health issue and figure out, what part of that do I want to work at, what level I can still be addressing it. And that's why I was saying before, is that you could take any topic. You could take roads. And roads can become a public health issue because of safety, just in terms of driving, or, do they have bike lanes, or do they have sidewalks? Pretty much anything we can relate back to public health. And oftentimes we're the ones who are bringing this idea to the Department of Transportation or to substance abuse or to corrections of let's think about it and how this.
And there's a lot of really great job searching websites for public health. I know Emory has a listserv, and a School of Public Health listserv, that they post positions all the time. I would also check directly with the state government if you're looking for HR positions. Every state will have their classified listing there. If your interest is nonprofits, there's a really great website. It's idealist.org. They do a lot of really great postings there as well. And I actually did an AmeriCorps term at one point in time as well, or national service, and they post a lot of those opportunities there.
There's a Maine nonprofit job board too, specifically if you wanted to look. In my field, where you would see folks with an MBA or BS getting jobs, there's a lot of health educator type positions. But if you find an agency that you really want to work for, just call them and see if you could job shadow or you could volunteer, and then sort of figure out where you might be a good fit. The one thing I can say, whether it's an MPH or not, is that people want to hire people who are motivated, who are good workers, show up on time, do all the basics. A lot of times people don't even do the basics. So just being able to work autonomously, doing the things that you say you're going to do, all that stuff, that really makes a big difference. One of the things that I remember I did when I was just graduating from college is I was applying for a job, and I just went to the job interview with my availability. And the boss was like, oh my gosh, this is making my job so much easier because now I immediately know what days you can work and when you can't. Just that little extra effort to show that you are committed or interested or being persistent, it really makes a difference.